Hello friends, let's today talk about the femoral neck fracture that is not uniting. First of all, let us understand what is femoral neck. So our hip joint is made up of two components. One is the ball component and the other is the socket component. The socket component is known as the acetabulum and the ball component is known as the head of femur. Now starting from the head of femur, we have a neck which is joining this ball to the rest of the femur bone. This part which joins the neck, which joins the ball of the femur to the rest of the femur is known as the neck. Sometimes because of fall or some injury, this femur neck can get fractured. And if after a reasonable period of time, it is not uniting, which is very common, if the bone formation is not there, then this is known as femur neck fracture that is not uniting. It is one of the most challenging things that can happen because there is a poor blood supply after this fracture to the femoral head. Now, this fracture may not unite because of many reasons. First is, when there was an injury, there was a destruction of the blood supply. So basically what happens, the injury happens, which causes the blood supply to go away, so the bone is not uniting later on. This can lead to avascular necrosis or shrinkage of the femur head also. Also, when the patient is old age or elderly or osteoporotic, the bone quality is not that good. So that can also be a reason for this fracture to not unite. Also, at this fracture particularly is at a mechanical disadvantage. That means sometimes to gain adequate reduction or strength on immobility, that is not possible during the surgery. So that is why we say, if at all this fracture is there, patient should not put weight over the fractured leg for a while. So all these factors do contribute to femoral neck fracture non-union. Sometimes everything is right, but if the surgery is done late, say after 24 to 48 hours of the injury, then also the femur neck may not unite because the blood supply is already gone by that time. Also, if the patient is a chronic smoker or alcohol user or is having diabetes or malnutrition, the femur neck may not unite. Similarly, if somebody is taking steroid or is having kidney related problem, then also there is a problem in the union. So normally the patient presents with persistent pain at the fracture site. Sometimes there is a length. Sometimes patient is even not able to bear weight over the affected leg. Sometimes there is a shortening of the leg also. That means one leg is longer, the other one becomes short. And of course, the movement of the hip joint becomes very painful. In such situations, normally we do a X-ray or a CT scan to see if fracture is uniting or not. If the fracture is not uniting and it is confirmed on X-ray or CT scan, then we do not wait for any longer. Because all this leads to AVN of the femoral head in some duration and will lead to greater problems. So normally in such situations, we go for surgery where we can replace this broken bone. Normally, if the patient is young, we go for surgery like total hip replacement, in which we change the ball component as well as the socket component of the hip. However, if the patient is old, say about the age of 70 or close to 75, then we can get away with half hip replacement, that is known as Hemiarthroplasty, in which we change only the ball component and we do not change the socket component or the acetabular component. So if somebody in your family is having femur neck fracture that is not uniting, don't worry, there are ways to tackle this problem. You should trust your orthopedic surgeon, you should consult him, and whatever is the next way forward, he will guide you. All the best.